We set this up very similar on how the Bureau of Workers' Comp is put in place. So there is going to be a commission that will send recommendations of people to the governor to make the final choice on the selection to run the agency.
And what, there's different industry sectors represented. What industry sectors will be represented? So you have folks from the healthcare community, healthcare advocates, to consumer folks, to folks within the insurance industry, insurance brokers, actuaries, people who has expertise in this field. There's a cross group of individuals.
Is there any other state that does it like this? Is this modeled after anything in particular, or is this something we just came up with here?
Well, the selection, so there's several considerations here that we played into. One is, do you have a private agency run the exchange? Or do you have a quasi-public agency run the exchange? Or do you have something sitting in, say, the Department of Insurance, the Department of Health, running the agency? We chose an agency that actually would be accountable to the elected officials, to the governors, to the General Assembly, to run this. So it's a quasi-public agency, very similar to the Bureau of Workers' Comp. So those are some of the considerations that other states have been wrestling with as to first the makeup of that. Then we actually turned to Ohio's experience on a commission, and a good experience on the appointment process and trying to get some balance is the Bureau of Workers' Comp Commission, and that's what we chose to go with.
So there would be like a nominating council?
Right, there's a nominating council.
Since Republicans in the legislature haven't shown much support here to move ahead on this, do you have any evidence that would tell us your bills are not dead on arrival?
Well, it would be sad for the citizens of the state of Ohio if these bills are dead on arrival. That's telling the citizens that the Republicans want the federal government to run the healthcare exchange in the state of Ohio, and I don't think the citizens of the state of Ohio want that.
Is there anything in these bills that goes beyond what is required for the state to meet federal requirements?
Right. So one of the considerations is, so if you look at what is covered, that will be left to, in a large part, the exchange agency once they get up and running. So that could go beyond the minimal coverage of what the federal government is requiring in the very basic insurance packages. And there's things like that that go beyond the federal legislation. So yes. This is tailored to Ohio to ensure that we protect consumers while providing a quality choice at a low cost in healthcare insurance.